Visual diagnosis, inspection, the tongue. Visual diagnosis of the tongue. Analysis of the tongue and pulse are some of the most important diagnostic tools we have at our disposal. The analysis of these two aspects of the body will often be used to determine a diagnosis, especially when doubt has arisen due to the symptom picture being contradictory and confusing. The tongue can provide us with a great deal of information. It provides an insight into the state of an individual's qi and shu and the state of the various zangfu organs. And it is an important tool for differentiating patterns in relation to the eight principles. Most people find tongue diagnosis easier to learn than pulse diagnosis. This is because tongue diagnosis is less subjective. With a pulse, it is easier to feel doubt. You can be uncertain that what you are feeling under the tips of your fingers and define as wiry, for example, is the same sensation that another person feels when they say that a pulse feels like a guitar string under the finger. The tongue is more objective. It is something you can see with your eyes. A pale tongue with a thick white coating is a pale tongue with a thick white coating. It is something that you can compare with a photograph in an atlas of tongue photographs. Pulse diagnosis requires repeated hands-on training together with an experienced practitioner, whereas tongue diagnosis can be learned by studying photographs of tongues with an explanation of which signs are significant on each tongue. There is also a greater consensus in textbooks and amongst practitioners about which organ the various areas of the tongue relate to in the body and the significance of the changes in these areas. The pulse positions and definitions are much more open to debate and interpretation between the various systems. The great strength of the pulse is that it is very precise, but it is also easily influenced and affected by many factors, which may only have limited diagnostic relevance. If you run upstairs, if you are momentarily very irritated, or if you have not slept all night, the pulse quality will be radically different than if you had been sitting calmly for an hour and had had a good night's sleep. The tongue, though, for all intents and purposes, would remain the same in these situations. The tongue gives us a good insight into the general condition of the patient. This is especially true of the tongue body itself. Compared with the pulse, the tongue is slower to manifest changes. However, the pulse's ability to change immediately is also an advantage. For example, if you can perceive immediate changes in the pulse when the body is invaded by wind cold, but changes in the tongue are difficult to detect in this situation. The pulse can also be used to control and adjust the needles that have been inserted into the body. Again, something that is not possible with the tongue. For its part, the tongue is excellent in showing the overall condition of the body and the imbalances that have been affected the body over a long period of time. There are also internal variations with regards to how quickly the different aspects of the tongue can alter characteristics. The color of the tongue body will not change as fast as the coating, which can change by the hour during an invasion of the body by exogenous species. The tongue body's shape changes more slowly than its color. The coating will reflect which influences the body has been exposed to during the previous hours and days. There are several reasons that the tongue is such an effective diagnostic tool. To start with, the tongue is a bodily structure that is simultaneously on both the inside and the outside of the body. Visually, it is something that can be observed from the exterior, but it is also a part of the digestive tract and thereby a part of the interior. The tongue's surface consists of a different cell structure than the normal skin. Both of these factors make it possible to see clearly the quality of the shoe, through the surface of the tongue. It is possible to observe fluids on and in the tongue body, and you can see clearly the influence of factors such as heat and cold. Changes in the pulse and the tongue. Pulse can change immediately. It can indicate what is affecting the body here and now. It can, of course, also supply information about long-term influences and changes, because these are the foundation of what is happening right now. Tongue shape. This can change over the course of weeks and months. This indicates which etiological factors and imbalances have affected the body over a longer period of time. The tongue color. This may change during the course of the day and from day to day. This indicates which imbalances and areological factors have affected the body in recent days. Again, as with the pulse, chronic imbalances will also be seen as they are part of the current situation. Now, the tongue coding. This can change by the hour. This can indicate whether the etiological factors and imbalances are chronic or acute. The tongue is directly under the influence of the heart. The tongue is supplied with shu and qi via the heart lumai. Shen, which has its residence in heart shu, is conscious of everything that is happening and in all changes that take place in the body. The Shen will therefore influence the tongue via heart shu. Apart from the heart lumai vessel, most channels have a branch that connects to the tongue. Kidney channel terminates in the root of the tongue. The spleen channel has an internal branch that connects with the tongue. The liver, stomach, urinary bladder, and the sanjiao have all divergent channels, connections with the tongue. The only channels that do not directly connect with the tongue themselves are the lung, the large intestines, the small intestine, and the gallbladder channels. They connect to the tongue through either their partner channel or deep internal channel connections. This means that changes in Zhangfu organ the tongue coating is created from the impure residue that is sent upwards by the spleen, along with good qi after transformation process have taken place in the stomach. The tongue therefore clearly shows the condition of the stomach qi. Finally, there are various microsystems on the exterior surface of the body where one can both treat and diagnose imbalances in the body. These are places where the whole body is reflected with a small distinct area. This is clearly seen, for example, in the ear. These microsystems exist because everything in the universe has an energetic resonance. Things will resonate and influence other objects that have the same energetic vibration. This is also true of the body. Specific areas within the body can therefore be affected by changes elsewhere in the body. This means, for example, that when the liver has been energetically or physically influenced, it can be observed and palpated in many parts of the body that resonate with the liver, including observable changes in the side of the tongue. Thank you for your attention.